Hello, today we are learning how to assist a client with the use of a bedpan. As you can see, there's two types. This one is a regular bedpan, and this one is called a fracture pan. We don't use it for regular person. It's very small, and when people have a fracture, they use it. So this is what we used. So that's how we do it. The supplies we need gloves, toilet paper, hand sanitizer, some towels, and pads for and basin and wipes and things like that. To successfully demonstrate this skill, you need to use the swipes, the communications, client rights, and common care practices. As usual, you need to assemble your materials for use, and you need to wash your hands before and after, and then you put your gloves on. You identify yourself and you explain what you're doing to the client and plan your action very well. So for this skill, for the first thing we do is before placing a bedpan, we need to lower the head of the bed down, and then we need to roll the client to the side and put the pad under for the bed. You don't have to put it, but if you put it, it's better. You need to wear gloves to place bedpan correctly under client's buttocks. I already told you there is a standard bedpan, and then there is a fracture bedpan. And here, what you're looking at is a standard bedpan. So when you put the bedpan, the bigger one goes to the bottom, and the small one goes to the foot of the bed. You can hold it like that and put it in, or you can just take it under like this. It depends how you do it. Whenever after you put the patient on a bedpan, have a client bend the knees and raise hips if able. And then you raise the head of the bed after placing a bedpan under the client. And then you provide privacy to finish for the client. You need to give a toilet tissue within client reach. You can give the wipes too. And then you go, you give them a call light or something to call you when they finish, or you can come back after a few minutes to check in how the person is doing. Ask a client to let you know that when they are finished, and offer to cover client with a bed sheet or blanket before you go. Make sure you provide privacy. Take your gloves out and clean your hands. This procedure is a two type gloves on. First, you put on gloves. You put the bedpans under the patient, and you take it out. You wash your hand, and then you come back and you do the same thing. You come back, you wash your hand, you put your gloves on, or you can use a hand sanitizer. So before you take the pads out, you lower the head of the bed before removing the bedpan. Then put on gloves before removing the bedpan. Make sure you put on gloves. It's assumed that the client cleans self by using a toilet paper. So we already give them toilet paper and wipe, so they cleaned it. Or if at the HCA exam, if they ask you to do it, you do a pericare. Okay, and then we put the bed down before removing it, and we remove the bedpan and empty contents to the toilet. And if you are using a cotton pad for the bed, it's time to remove it the same time when you take the bedpan out. And clean the bedpan to the toilet by rinsing it and drying it and putting it away. Provide perineal care if you have to. I mean, normally you do it, but before the exam, I don't think you need to do it. You can ask the instructor, you want me to do it or you want me to verbalize it. And clean and sanitize equipment as protocol. Return to the proper storage. Remove disposable gloves and wash hands, and you're done for this procedure. Thank you.